This is a demonstration of Allscripts Professional EHR for OBGYN. Today we're going to demonstrate how Allscripts Professional EHR can overcome your daily challenges and help you achieve meaningful use. In OBGYN practices, most providers are challenged with pregnancy management, quick and easy access to lab results, message triage, quick access to patients' charts, and preventative maintenance follow-up. Allscripts Professional EHR can help make your life a lot easier with prenatal record, result notifications, messaging, face sheet, and alerts and reporting. Now let's take a look at how Allscripts Professional EHR can help meet your needs. As you can see here, you're logged in as Cindy Pope. She's the nurse for today's scenario. Cindy is looking at the schedule for the day, including why the patient is coming in for their appointment. The patient's name is in black. That simply means they haven't checked in yet for their appointment. If their name appears in blue, that means the patient is sitting in the waiting room and has checked in. The green indicates the patient's chart has already been started by the nurse or the MA. The red simply means the patient is checked out. For today's scenario, you'll start with a gynecology visit for a patient coming in for vaginal discharge. The nurse will go in and document the patient's history, update the reason for their visit, and send the chart to their provider. When you open Diana's chart, the first thing you see is an alert telling you that she is due for her mammogram. Next, you can see the face sheet, which shows you her entire chart in one screen. This shows her problem list, her past medical, surgical, family history, allergies, and medications list. Her encounters are displayed here to the right, showing her office visits, her consults, any well woman visits, any phone calls that have come from the patient, her current meds list, and any orders for that patient. So let's get started documenting with the patient's visit for vaginal discharge and itching. First thing you'll do is indicate and document her vitals. Because she's been in the practice before many times and she's an established patient, you can pull in her previous height and weight. She's gained weight. It's very easy to change that just by simply typing in the new number. Her blood pressure is normal. Once you select that and enter that information in, you'll notice that it does show you her height and weight over a period of time as well as her blood pressure. The BMI is automatically calculated from her height and weight. Her complaint is documented next. Again, she's here for vaginal discharge. She has itching as well as burning. As you select your template, you'll notice it actually creates the note here at the bottom. She tells you that the onset has been for the last 3 days. The patient's history has already been stored in the patient's record. Though the patient could have gone into the portal and updated her history with any changes that had occurred prior to coming to the practice. If that's the case, the nurse simply selects the history and includes her active history and pulls it into today's visit. If there are any changes that need to be made, if the patient forgot to indicate that she is allergic to sulfa, here you can go in and add that change. Then go to the patient's medication list, select sulfa drugs, and then indicate her reaction, hives. If you want to pull in her previous meds list, select Include Current, and that'll pull her meds list for today. She's no longer taking her medication for diflucan. You can simply select that and indicate that it's no longer active. That's been displayed in her chart and will always remain in her record. Her social history has also been completed with her smoking assessment for tobacco use. So now, you've just met all of the meaningful use requirements as far as her history is related. Her review of systems was also filled out in the office. You could pull that information forward and it shows in the positive and negative findings for this patient. If she also indicates that she has painful intercourse, you can select this because right now it's showing as a negative. If you want to make that a positive for painful intercourse, select it. It brings in a list of choices. You select the choice. It now shows as painful intercourse, but you want to mark it red, and there's your change. So finally, here's an example of what the note looks like before you send it off to the provider. You're going to send that over to Dr. O'Brien's inbox, indicating which room you put the patient in and that the patient is tired of waiting. Now the chart has been sent over. Dr. O'Brien logs in and sees that the patient is here, ready to be seen. She'll go over to her queue and see all of her patients that are waiting to be seen. By selecting the received charts, she can see exactly where they are. Once the doctor opens the charts, she sees that sticky note that was put on by the nurse. The patient is tired of waiting. She also sees that the patient is due for a mammogram and makes sure she orders that for the patient as well. Here's the same face sheet that the provider saw, and here's the note that was started by the MA. So the provider can review the note quickly, but notice that the meds list was not reconciled. So at this point, the provider will go back to the history for the patient and ask the nurse if that meds list was reconciled. The provider can check the fill history, which shows all the medications that have been prescribed to this patient by any provider as long as they fill that prescription with their insurance. There were no medications that are available for this patient, so therefore the meds list has been reconciled, which is now meeting another meaningful use requirement. Now the provider can go back and look at the note to make sure it's all updated. And here it shows the change. The provider wants to go back and review any past visits and can very simply do that by selecting the encounter side again and just selecting the date of service that she wants to see. There's a visit that was done back in February. Now the provider is ready to see the patient. She'll go in, talk to the patient a little bit more about her complaint, and document any other problems. The patient indicates that her discharge is yellow and thick. She is sexually active. However, she does not have any urinary symptoms to go along with it or pelvic pain. So, as you add to the note that was already put in by the nurse, it documents it right here in the line note. At this point, the provider moves on to the physical examination and document findings. You're pulling in your template for vaginal discharge and itching, and it automatically pulled in the positive and negative findings. If there's anything you need to add to this, you can simply select again in the note, look for anything else you need to add, and make the change. The provider can also bring up a picture diagram to indicate any other findings if necessary. So at this point, the doctor notices something here on the patient that's necessary to mark that's going to show up on the diagram and now pulled into the patient's record. Under the assessment and plan, you have protocols set by diagnosis or by problem. Her protocols list shows the common diagnosis given by a type of visit or the problem that the patient's coming in for. In this case, the patient is here for vaginal discharge. The provider documents and diagnoses the patient with vaginitis. Here's the ICD-9 code along with the treatment plan, so you'll select that into the patient's record. And then you'll notice that the diflucan comes down with the red X, which indicates that it is not covered under the patient's formulary. In that case, you can swap the diflucan out for a different medication that is covered under the patient's insurance. By selecting the alternatives, it gives a list of all the drugs that are chemically equivalent and on formulary for that patient. You select the appropriate medication and write the prescription. Now, the note has been completed and you're ready to sign off. Here's the final note and what it looks like after the completed visit from the provider, the patient, and the nurse. The provider is ready to sign off for it and bill for the visit. Running the E&M calculator shows the diagnosis that is selected by the provider. This is a new problem with no additional workup plan. The provider did write a prescription and you're ready to calculate the visit. This is giving you a 99214, and the summary sheet says based on what was selected from the template, here are the bullet points that were met during that documentation. The history was detailed. In order to achieve a comprehensive history, you need to document at least 10 review of systems, because you got a very good history that actually helped boost your level of service for billing. You're going to accept that code, sign off, and once you sign off, the super bill has been generated. So the super bill shows the office visit code that you just saw a moment ago with the ICD-9 code and the billing codes for the wet mount. The encounter pack will allow you to generate a referral letter back to the referring doctor if necessary and a clinical summary for the patient at the time of checkout. The clinical summary is a meaningful use requirement that says you must be able to generate a report to the patient at the end of every visit. Once you sign off, all 3 of these documents are generated. Here's the prescription going to the preferred pharmacy with the doctor's signature already in place. And the 2 letters, the referral letter to the referring doctor as well as the clinical summary to the patient. This is also where you would create a referral letter to refer the patient out to another specialist. Here is the referring doctor, assessment and plan, sincerely, the doctor. If the doctor wants to make a change here, indicate the patient is not very pleasant, you can make that change right here on the fly and take out whatever data that you don't want to have in their record. And now, that's also been changed automatically. Clinical summary shows the entire visit for today, again meeting meaningful use. Once that has been signed off, it files itself right back into the chart, And now you're on to the next patient. Your patient, Darlene Drake, is here for her prenatal visit. Once the provider opens her chart from the schedule, you can immediately see the patient's estimated date of delivery, the fact that she needs her refill of folic acid, and if she is having cancellations and no-shows, that will appear here as well. You'll go in and begin documenting her prenatal record visit. You can certainly go in and see exactly what was done the last time you saw this patient and how she is doing. Here are all the comments that were entered in by the staff or by yourself. The problem list indicates her diagnosis by ICD-9 code, and then also you're seeing the other problems for this patient as it relates to her pregnancy. If you want to include another problem, simply hit the Add button, and then find the area that you need to add. If she desires a C-section, you can put that into the record and document that into the chart. Her meds list also appears again. As you saw earlier, she is due for her folic acid refill and then her lab results. Once you select and open her prenatal record, you can begin documenting for today's visit. The maternal fetal data is where the flow sheet information is pulling from. You indicate that the patient's baby's heart rate is at 155, and then you can also indicate her cervix exam. If there's anything that you need to document here, you can certainly do that and then move along in the visit for her next appointment and any comments that you need to make. All the information that you document based on the maternal fetal data and her cervical exam will display in the final record. So the patient is doing well. Once you've added that into the record, then you can fax this over to labor and delivery at any point. Here are the comments that you've made. Here's the entry that you made for today's visit, and then if you're done with the visit, you can finish and sign off on the note. This is one example of the note in the prenatal record and what it looks like. This can be very easily customized from one practice to another. Here's an example of a note that was customized based on the needs of a practice. It has the entire full flow sheet as you can see, and this happens to be a very detailed one. It also includes final examination, any labs, all the labs that were done and the results of those labs, and any additional comments and instructions. So this just gives you an idea of how the prenatal record can be customized based on your needs. Over to the cues here, you have the ability to focus on those items that need to be addressed for the patient. For example, any result notifications that have come back into the provider's inbox will display here. Any result in red indicates as abnormal. Those results in black indicate a more normal result. When you review the result, it shows all the orders that have come back in with their results through the interface from the lab. By hitting Review All, it automatically signs off those labs and you can actually push those through the patient portal to notify the patient and include any comments that you wish. If you want to send a message to the nurse, you can simply send this message by selecting this little icon here. Now the results have been signed off on and published to the portal. Messages. Any messages that come across from the nurse or if the patient has called in requesting to speak to you, that shows up in your inbox. For example, this patient has abdominal pain, and you open that message. It says please call her at the above number for lower abdominal discomfort. This allows you to see very quickly her last office visit and when her next appointment is. You can send a message back and tell the nurse to have her make an appointment immediately. That message will go back to the nurse and out of your inbox. For preventative health maintenance reminders and alerts, a reporting feature allows you to generate reports for all patients with reminders in a certain category, for example, mammograms and pap smears. You'll notice here a list of all patients that need a 3-month follow-up pap after a LEEP has been performed, all active female patients over the age of 40 without a mammogram or patients who have not had a pap. You want to see the list of all those patients. Not only will it flag the charts for those patients immediately, but it also puts those patients on a report, as you can see here. If you want to send a letter to those patients, you can generate a mail merge and notify the patient via mail, or you can notify the patient via the portal depending on the patient's preference. Your letters are already generated here, and you can very quickly create those letters and then again send them to the portal or call the patients if that's what they prefer. So here's an example of a letter already generated and built into the software. These are also able to be customized. So these letters can go directly to the patient either through mail or through the portal, or you can simply call the patient if that's what the patient desires. Next, you have meaningful use reporting available as well. All the meaningful use core measures are preloaded in the software, and you can generate reports based off of the needs of the provider and the practice. These reports can be run on a schedule. For example, every Monday at 9 a.m. the doctor wants to see all her patients due for a mammogram, and also the administrator wants to see all providers and how they're meeting meaningful use for e-prescribing. In the case of the meaningful use e-prescribing report, you simply generate that report by selecting it, and it shows a list of all the providers and where they fall as far as meaningful use is concerned for meeting e-prescribing. You have Dr. Entler, who's only at 50%, another one is 63%, and another at 100%. Allscripts Professional EHR not only addresses your daily challenges, but connects to 180,000 physician users, or every 1 in 3 physicians uses our products, 1,500 hospitals, third-party devices and applications, labs and pharmacies across the country. Allscripts practice management solution seamlessly. The Allscripts referral network. To patients through the patient portal. To patient charts remotely with our Allscripts Remote for Apple iPhone, iPod Touch, BlackBerry, or any Windows mobile device. It is your entire healthcare community connected. To request a custom ROI assessment or a personal product demonstration, please call Allscripts at 1-877-EHR-NOW1 or email ehrnow@allscripts.com or visit www.allscripts.com/professional.